name is Zach. I'll be your nurse today. Can you please state your name and date of birth for me? And check both wristbands, both of them match. Do you have any allergies? And are you in any pain? All right. So I'm here to give you your meds. I'm just going to call the doctor real quick to verify the medications that we are giving to you. Now I'm going to call the doctor to verify the meds that we are giving to the patient. So I'm calling about Edith Jacobson. She's an 85-year-old female patient with a history of osteoporosis and dizziness, and her admission diagnosis is a hip fracture. Are you aware of who I'm talking about? Yes, okay. So we're going to give her enoxaparin, 0.3 milliliters deep sub-Q. We're going to give her 12.5 milligrams of hydrochlorothiazide, and we're giving 0.5 milliliters of morphine sulfate. Does that sound right? All right, thank you. It was all right. So now I'm going to start preparing the medications. And I've already done 2 checks to make sure that I have the right medication when I was pulling it out of the Omnicell. That was my first check. The second check is when I compared it to the patient's MAR. And I'm going to check it one more time right now to make sure that I'm giving the patient all the right medications. So they're all right. I'm going to prep the hydrochlorothiazide. This is 1 tablet, which is 25 milligrams, but we need 12.5. So I'm going to cut it in half because it is a scored tablet. So half of that tablet. And also, before I prep these needles, I need to assess the vitals on this patient to make sure we don't have any drastic changes after we give the medications. So I'm going to check the blood pressure, respiration rate, heart rate, pulse ox, and make sure everything's okay so that, like I said, so that we know that one of these medications didn't have a dramatic effect on the patient. Okay. All right, so now I'm going to prep the enoxaparin sodium. And we need 0.3 milliliters. Okay, so I have 0.3 milliliters of enoxaparin sodium prepped in here. Now I'm going to cap it. So that is ready to go. Now I'm going to prep the morphine. All right, so grab an alcohol swab here. Make sure this is the morphine. And now I'm getting half a milliliter.
We're going to each other. Thank you.
I'm going to cap this needle with one hand. All right. So now I have the morphine, the enoxaparin and the hydrochlorothiazide all prepped. So as I'm administering these medications, I'm going to, like I said, give the patient a brief education on why they are giving it. So I'm going to grab a new alcohol swab, and we are giving the first two medications, the injections, deep sub-Q. So to start, I'm just going to rub in a circular motion the injection site. Let that dry a little bit. You don't want to fan it. Okay, so now this is the enoxaparin. I'm going to go at a 45-degree angle and inject it slowly. And pull it out quickly. Alright, so I'm going to cap that needle. I'm going to cap it with one hand by just placing it like this and capping it. This is going to go in the sharps container. And now the hydrochlorothiazide, I'm going to do the same thing. You would normally, I'm sorry, this is the morphine, not the hydrochlorothiazide. And whenever you inject this medication, you usually want to find an area that has more fatty tissue, so somewhere like the abdomen, somewhere in the abdominal area. So we're going to do the same thing. And I should have done this for the first injection. I want to make sure that the bevel is up. And I'm going to go at a 45-degree angle.
I'm stealing your pencil. Oh.
Inject it slowly. And pull out quickly. And I'm going to recap this needle with one hand. Alright, so we just gave you enoxaparin sodium, which is an anticoagulant. It's to prevent pulmonary embolism and deep vein thrombosis after hip surgery, which is what you just had. Okay, and just some effects on the lab results you might have. You might have a decrease in platelet count, so we're going to want to watch that. And you might have difficulty breathing, and your skin might feel a little itchy, some irritation, might have some pain, possibly hematoma and redness at the injection site, so we're going to want to watch that. You might also have some edema or nausea and diarrhea. Alright, and the other medication that we just administered was the morphine. So the morphine is an opioid analgesic. It's a pain medication. And it may cause dizziness, which you said you have a history with dizziness, so if you need to get up and go to the bathroom or something like that, just let somebody know. We don't want you to get up and fall, not expected because you're dizzy. Also may cause drowsiness, headache, euphoria, lightheadedness, nightmares, sedation, seizures, depression, hallucinations, nervousness, physical dependence, or anxiety. It also make you have a fast heart rate, possibly cardiac arrest or shock. Okay, and now we have one more medication, which is the hydrochlorothiazide. This is a diuretic. This is going to help prevent any edema or fluid retention. So this is a tablet. Like I said before, it is a scored tablet, so we have cut it in half because she only needed half the dose of the tablet. So before we give it, we're just going to make sure the patient is at least 30 degrees, at a 30-degree sitting position. Give them a drink of water and give them the tablet. And they took it. So the patient has had all the medications now. I can finish up by giving them a little bit of information on the hydrochlorothiazide that I just gave her. So this could also make her dizzy, have vertigo, headache, paresthesia, weakness, restlessness. Serious cases could involve renal failure, polyuria, frequent urination, intestinal nephritis, or erectile dysfunction, which she does not have to worry about. Also, for the hydrochlorothiazide, she could have muscle cramps because it is a diuretic, and diuretics are potassium-wasting medications. So when you're low on potassium, we know that causes muscle cramps. So we definitely want to make sure that we keep an eye on her potassium levels to avoid hypokalemia. Also avoid licorice because that may also aid in potassium loss, and also avoid alcohol because alcohol is a diuretic in itself. You don't want to take 2 diuretics at once. Also try and take this hydrochlorothiazide in a day because it does make you urinate, so you don't want to take that right before bed. So we will be sending the patient home with all of this literature so that they can have all this information ready to them, and just go ahead and clean up the work area here. So before I leave, I'm going to make sure the patient's bed is lowered all the way down. Make sure they have at least 2 of these side rails up. Put the call light in hand. Is there anything else I can do for you? No? All right. Thank you very much.